Well, if you want people to be happier, don't make them wait for 12 hours.
There's a nursing shortage across the country.
Why does it seem like the healthcare system is poorly funded when we spend more on it than any other country?
Well, we're spending the money in the wrong places.
Our budget can't support that.
Oh, here's a dirty little secret. The hospital saves money keeping patients down here in the pit. It's way cheaper than staffing upstairs.
It's not the whole story, but it's one answer. We have a tremendous amount of infrastructure, especially in the insurance area, that probably doesn't need to be there. This isn't necessarily the episode to talk about it, but you've certainly heard that insurance companies require physicians to get prior authorizations, most of which are unnecessary and probably don't drive better care, but it delays care and it's a tremendous infrastructure that costs a lot. That's but one example. There's a significant amount of consumerism that we've baked into our healthcare system, that people can go get not necessarily the treatment that they need or is evidence-based or that will be good enough, but the treatment that they want. A lot of that is driving healthcare costs up. We probably have an overspecialization in our country. That is, not enough general practitioners or primary care providers or pediatricians or even general psychiatrists or OBGYN providers, but more specialization that may or may not provide better care, may or may not provide better outcomes, but get paid a lot more for the high-priced procedures that they.
It's a specialty. It's simple, supply and demand.
And you hear these themes play out in the pit. You hear that they may have actual physical beds upstairs in the hospital, and that's the dynamic that you hear in most hospitals. The ER is on the ground floor, the rest of the hospital is above.
Most of our patients are boarders who are waiting for a bed upstairs.
We don't have the beds.
That's bullshit. The beds are up there. You just don't want to hire the staff you need to care for.
That they have more beds upstairs, but they can't staff them either with nurses, or that specialists are holding on to the beds for cases that they want to bring up and not necessarily the ones that the emergency department wants to send up. There's a whole bunch of political interplay that goes on inside any hospital.
Yeah, the political interplay is going to be there regardless. Right.
Sure.
Like even if we move to like a single payer system, the political side is going to be there.
Oh,
is the answer moving to a single payer system?
I think yes, but only because the system that we have now appears so broken. I think there's a lot of evidence that other.
I want you to hit me as hard as you can.